সার্জিক্যাল সাইট ইনফেকশন, এটা কিন্তু কোশ্চেন আসে খুব, না হলেও অল্টারনেট ইয়েতে আসে। আমি যেটা বলবো তোমরা বুঝে নাও আগে, লেখার জন্য দেখবে প্রচুর থাকবে, অনেক সময় পাবে, ভয়েরও কিচ্ছু নেই, হ্যাঁ, ভূতেরও ভয় নয়, ইয়ের ভয় নয়, কোনো কিছু নয়। পরীক্ষার সময় সবটাই হবে এবং ভালোভাবেই পরীক্ষা দিতে পারবে, এবং এটা দরকার আছে। জিনিসটা এরকম, সার্জিক্যাল সাইট ইনফেকশন বলতে আমরা যেটা বুঝি, দ্যাট ইজ এ ইন্টারন্যাশনাল টার্ম, SSI, ছোট s, it denotes infections plural number, nothing. So surgical site infection, the infection where the intervention occurred. মানে কি? Meaning there is intact skin, I make an incision, better I made an incision. Incision is never done, always made. So that is an artificial wound I created. That is an iatrogenic injury over the skin. Thank God it heals following the rules of wound healing. If not, then there is infection. That is surgical site infection. And what are those things? Those causes the surgical site infection. Look, 1 2 3 4 তোমাদের কি এর টেলিফোনে পেয়েছো? এখানটাতে বড্ড ইলিজিবল, পরিষ্কার হচ্ছে না। যদি না পেয়ে থাকো দেখো, যে সার্জিক্যাল সাইট ইনফেকশন বলতে আমরা কিছু কিছু জিনিস বলি, আবার কতকগুলো জায়গাতে আমরা সার্জিক্যাল সাইট ইনফেকশন টার্মটা ইউজ করি না, দো দেয়ার ইজ ইনফেকশন। One is stitch abscess. The wound, we have to bridge the gap, two margins, either by suture material or by apposing clips, stainless steel clips, or by applying glues. What is the name of the glue? Cyanoacrylate glue. It's a potassium cyanoacrylate, it's a sodium cyanoacrylate. So আমরা যেগুলো Fevikwik, that glue also used in the apposing the two flap of the wound margins, and some strips. I made an incision. What happens? It's like this. When I cut somebody, if I pull it, so it gives the appearance like, so this is a wound. When the flap 1, flap B must come side by side to follow the rules of wound healing. আমার একটা ছোট্ট দুষ্টুমির কথা মনে পড়ছে, তো তোদের বলি বাচ্চা বাচ্চা শব্দ। এটা 5 ইঞ্চি ধরে নাও, 5 ইঞ্চ wound, আর এরকম একটা কাটলাম 2 inch wound. Healing process will be faster in 2 inch. It is true or false? 100 নম্বর বলে আমাকেই ধরলেন শেষে। A 5 inch wound and 1 inch wound, obviously small wound heals faster than the larger wound. True or false? Madam, এটা পরে এখান থেকে পাস করে যখন যেতে হবে ভালো করে, তারপরে এনাফ টাইম পাবে ফর দ্য লাইফ, আমি তখন হয়তো দেওয়ালে থাকবো। ট্রু ফলস? তাহলে which one is true? ও বলছে ফলস। 100 একশো নম্বর। ট্রু ফলস? 2-inch wound heals faster than the 5-inch wound. True, false? Quick. আমাদের আর কয়েক মিনিট। Yes, no? Yes. Okay. তা 50-50 হয়ে গেল। Wound healing starts from everywhere. So 5-inch wound or 2-inch wound, all the wound will start one end. So all the macrophages, all the tissue healing, factors of wound healing comes in the same part. The same time will be taken to follow the wound healing. ঠিক আছে, 2-inch wound and 5-inch wound both heals at the same time, but tensile strength of the 5-inch will come later. Tensile strength of the 2-inch may or may not be the same at the same period of time. ঠিক আছে? Anyway, so আমরা so this is a flap too. So how can we make the flap closer together? Unless it is close together, the wound healing will take place, but with a fibrous band. That is a very non-tensile, non-strengthable wound. So primary union will occur if the two margins come very close together. So what are the, one is stitch, one is apply the glue, one is strap. Paper strap, multiple paper strap. At times it was done by threads. So multiple threads over the opposed wound, and the threads are supported by some straps. So there are various techniques by which we can oppose it. So the stitch abscess, it is a created one which we cannot be reported as an surgical site infection. So by definition, the surgical site infection is, it is within 30 days of operation it came, that is a surgical site infection. Without implants or without any artificial aids. Artificial aids mean for a pacemaker, for a wound with a nail and pin. These are all implants. With implants, if the infection persists 1 year, that is a surgical site wound. Without implants, it is 30 days. It is a very arbitrary period, not that exactly 31 days doesn't mean that this is not a surgical site infection. Second one, the episiotomy wound and circumcision. What is an episiotomy? What is episiotomy? তোমার নাম কি? You. Please come. Here, come here, please. Come, quick. No option that you have entered in the process of a medical field. You are going to be a doctor. What is episiotomy? Anybody? Yes, right. Then we make a deliberate incision by which the tear is avoided. Thank you. Sit down. So এগুলো তোমরা জেনে যাবে, আজকে জানি না বলার কোনো দরকার নেই, আমরাও জানতাম না। So this wound, episiotomy wound, is a deliberate wound. So it is not a surgical site infection. The wound is usually made for the better protection of the tear of the wound. Infected burn unit. So burn is iatrogenic. So that infection is never denoted as surgical site infection. And the infection extends into the facial muscle, in the fascial muscle. These are very common because vascularity is more, infection and bacteria load is more, at the same time healing is more, at the same time infection is also percolated very frequently, different parts, different planes of the tissue. So these are not denoted as the surgical site infection according to the Center for Disease Control, CDC. And what happens if the surgical site infection occurs? So what are the sequences we follow? One is increased morbidity. Rather, these are the factors by which the infection rate is augmented, or infection rate is more than the normal people. What is morbidity? What is morbidity? Comorbidity. Co means associated morbid condition. Name one morbid condition. Diabetes. Okay. Very. Renal failure. The patient having the chemotherapy. Patient with the AIDS, AIDS. These are compromised patients, those who are with the comorbid conditions, and they are very prone to develop surgical site infection at the laparoscopic opening. That port site infection. What happens? During laparoscopy, we made an hole there in the abdomen. Umbilicus is situated in the midline. So this is a port. Rectus abdominis, transversus abdominis, and internal oblique, external oblique. They form a meshwork. External oblique downwards and medially, like the hands in your trousers pocket. Okay, so this is the transversus abdominis and internal oblique. They form a mesh. Over we put a hole over there to push the laparoscopic camera, fiber optic camera. So by this we make a hole. Obviously these fibers are torn or destroyed, and it heals by the fibrous tissue, actin, myosin, those fibers heals by method of fibrosis. Fibroblasts come. wound healing তো হয়ে গেছে তোমাদের, হয়নি? যাই হোক, so mature fibroblasts, immature fibroblasts, and they immature fibroblasts first come, they form a meshwork, and over that the fibrin meshwork, and this is the process of wound healing takes place. হবে তোমাদের কাজেই then this hole is a potentially dangerous hole for inviting the bacteria, because this is rough area and smoothness has gone, the mucosal lining is torn, that thereby the infection rate is more on the port side. Chronic infection, acute infection. Name one chronic infection in our Sonar Bharat. Tuberculosis. That is pulmonary tuberculosis and extrapulmonary tuberculosis. So anywhere in the body the bacillus, tubercle bacillus may set in. That is the unique part, because the tubercle bacillus is very prone to develop in the oxygenated area. Raja bacillus apical lung e hoy, je sob jayga gulote vascularity is more, they pick up the area and create the nidus. So nobody is scared from the tuberculosis. So this is a chronic infection, and acute infection is done by streptococcus, staphylococcus, streptococcus aureus, staph aureus. কেন aureus বলে বলো তো? aureus means, এই সুদুকু না কি খেলছিস, কি লিখছো কি তুমি? Streptococcus aureus, Staphylococcus aureus. What is aureus? Aureus means AU. The scientific symbol of Fu, iron. AU, gold. It gives a golden yellow colony. That is why it is a Streptococcus aureus. So the acute infection is caused by methicillin resistant or MRCS, MRCNS, Streptococcus, Staphylococcus, Pneumococcus. These are the coccus group, and chronic infection is by tubercle bacillus or sarcoidosis or lepromatous bacillus. So these are the types of wound healing in the surgical site. One is the clean contaminated wound. It is a superficial wound, just beneath the skin. What are the layers of the skin? Yes, skin, subcutaneous tissue, then mucosa, submucosa, and the fibrous tissue, muscular layer, muscularis mucosae, and so on. So the one is 4 types. Clean contaminated means a wound apparently it looks clean, superficial, but it is contaminated by some dirt or some bacterial invasion. And clean and contaminated wound, CO. Contaminated means it is definitely contaminated. A motorcyclist on the road and he or she sustained some injury. That injury is mingled with the dust of the roads and that is contaminated wound. So once a person attend your clinic, attend the emergency with such an history, then take it granted that the wound is contaminated. So you have to follow the rules of management for a contaminated wound, right? Apparently at that point of time he or she may not develop the sign and symptoms of the contamination. And other is dirty wound. For ছিটকে পড়লো মাঠের মধ্যে, কাদা টাদা মেখে wound এলো, that is a dirty wound. And long term with a comorbid person there is a associated injury is there, that is a contaminated wound. So these are the 4 types of wound. Now what is a nosocomial infection? The term nosocomial infection, NOSOCOMIEL, nosocomial infection. It is a hospital acquired infection, is called nosocomial infection. Not that it is done every time in the hospital, but the condition home at hospital or hospital at home is the same part, because it is a resistant type of bacillus or streptococcus that creates the wound and wound healing. For the contaminated, it is a clean contaminated wound or it is a dirty wound always. That nosocomial infection occurs mostly in the hospital and very frequently at the ICU and in the dialysis unit, where the recurring many patients take their advantage in the for dialysis, and that the beneficiaries of the dialysis unit are very prone to develop that nosocomial infection. And at the same time this type of infection is prevented and by the mode of prevention and by the management eradication. Eradication কি করে আমরা করি? By using sterile gloves, by using autoclaved instruments and autoclaved linen, autoclaved, and by the other methods of sterilization, that gas or ethylene oxide, what it may be, the method of critical sterilization. Again, what is a critical sterilization? Any idea, anybody? There must have some non-critical sterilization. It is a critical sterilization means the cysts are destroyed. Non-critical sterilization is an example of a laparoscopic camera. It is never put in the autoclaved instrument because of destruction. So it is sweep off and wipe off the load of bacteria is reduced. But at the critical sterilization, every instrument is the cyst or the bacteria free. So there must have some parameters of sepsis. Sepsis means some criteria or combination of criteria which gives the person in a critical stage of illness, mode of illness. That is a septic condition, and it is mostly created by the bacteria. If it is mostly some created by some other than bacteria, what is that? Raised blood sugar, because blood is a very good media for inviting bacillus. So what are the criteria? The history of morbid and comorbid state, signs of sepsis. So there must be dolor. Dolor means on pressure there is a pain. ট্যাবলেটের নাম দেখেছো না, ডলোপার, ডলোসিং. These are dolor means this is a painful condition. So pain is there. Pallor means that is either blanched, their blood is less whitish, or that is rubor, more red. More red, why? More red? Hyperemia. Blood vessels are there with the load of their armaments, and those soldiers come here that carried by the RBC and WBC. So that is area is red and hot. That is dolor, pallor, rubor, calor, and punctulosia. That area is painful, swelling, that function is less. These are the basic signs of a injured person or an signs of infection. Pulse rate, normal pulse rate is, say for example, 100. If the pulse rate is more than 100, then it appears that during the infection the pulse rate is raised, temperature is raised 38 degrees centigrade. So it may so happen that temperature also come down 34 degrees centigrade. Then there is also infection. Why? কে বলবে? More than 38 raised temperature, it is infection. Less than 34, temperature is subnormal, that is also infection. That is, the person is not generating the temperature because of immune suppression. One condition is typhoid fever, another is AIDS. The patient receiving chemotherapeutic agents, and some immune compromised patients, they never develop temperature, but infection is there, bacteremia, bacterial invasion is there. That is a very grave condition rather than where the temperature is raised. So 38 degree, yes, there is infection. Below 34 degree, yes, there is infection. That is more than 38 degree. Again, WBC count, that is a parameter. WBC count, white blood cell is increased in case of infection. What is the normal WBC count? 4,000 to 11,000. Very, very good in the sense. Then very bad question is, if somebody gets the 4,000 WBC count per cubic millimeter, is there any infection? 3,000 per cubic millimeter. What is the significance of the study material? তোমার হাতে দিয়ে দেওয়া হলো, patient is WBC count 3,000 per cubic millimeter. What is the inference? Again, if there is infection, why? CD4 count is not increasing. She or he is immune compromised. That is why WBC count never gets. This is WBC, rising titer of WBC is a sign of infection. At the same time, it is a protective work. So he or she doesn't get the protection. So below 4,000 and above 11,000 is a sign of infection. Below 4,000 is again a grave sign, because WBC, the soldiers are not coming to the field. Again, Respiration rate. What is the normal respiration rate? 20. Adult respiration rate 20. So with infection it goes up. Rate of respiration goes up. Sign of infection. At the same time, if it comes sign of hypopnea, then the same part, it is a sign of infection. Number 4, urine output. What is the normal urine output of an adult? In 24 hours, it is 1500 ml, 1000 ml for a round figure. So, in a critical patient, you are not going to calculate over the period of 24 hours. For example, this time in the clinics, one patient came with the low urine output. You will have to wait for next 9 a.m. on the next day, day 1811, that to calculate the 24 hours urine. So, we gauge that it is an hourly input chart, hourly urine output chart. So, input is there, urine is a waste product. First, if we take the water, then it is absorbed in the intestine. Which intestine is mostly absorbed water? Large intestine. ওপরের স্মল ইন্টেস্টিনের পার্ট কিছু নেই, ওখানে গিয়ে লার্জ ইন্টেস্টিনে ম্যাক্সিমাম অ্যাবজর্পশন হয়, দেন দ্য স্টুল ইজ ফর্মড and the water is again recycled. This is the, it takes no pump mechanism, but the pump mechanism is there in the cell for sodium salt, that is called sodium pump physiology. Okay, then this is exploited in our day-to-day medical management. So, the urine output in 1 hour urine output is 10 to 20 ml per hour is the normal urine output. So, we have to guess that whether 1 hour judgment that how much urine is she or he passed by method of putting a indwelling Foley's catheter. So, a critically ill patient must be treated critically, right? Infection is a critical condition. So, a critically ill patient must be admitted first. No domestic management is possible, and there are some few lines, few steps, few institutional procedures as to manage the patient for a critical condition. So, that this infection, to control the infection in the metabolic system. So, urine is passed through the glomerular filtrate, then it is again with the system and again come by which the waste product is excreted. So, urea, creatinine and protein in some amount, not in much. Protein is not excreted normally in the urine. So, the 1 hour urine output is only 20 to 30 ml per hour. And another parameter is very much recorded or very much calculated during the management of a critically ill patient, that is C-reactive protein, CRP. I think all of you have heard the name C-reactive protein, and that is 0.9 milligram per deciliter is the normal value, but it does not mean that 9, it came 10 that is the C-reactive protein is high, not that. If the high value is more or less more than 30. For your keeping the memory, it is a 50 is the high value. So 10 to 50 is the normal value in our day-to-day calculation. The management, such a patient to be managed. If a patient, you are in the emergency room, emergency officer, a patient like this came to you with such and such, these are the signs and symptoms you noted, or your team has attended the patient and they noted it, that this is our findings. So you definitely admit the patient in the institution. This is an institutional treatment, not an individual one. Next, resuscitate the patient. What is resuscitation? Resuscitation means bring the patient to the normal. Pulse will come to the 100, urine output will be 30 ml per hour, temperature will come down. This is the ideal condition by which we can call the patient is resuscitated. Thank God. Such a patient, your team has resuscitated the patient, that now the patient's symptom was there and WBC count and others that came down, the patient is resuscitated. Thank God, again it rolled back to a condition. So there are 4 conditions in our sets of resuscitation. All the things came with the first word R. So 4R and a snap deal is the basic line of management. So 4R, one is resuscitation, second one is restitution. বানানটা একটু বুঝি গভর্নমেন্ট যাই হোক, anyway, restitution means, and third one is restoration, fourth one is review or rehabilitation. So 4R is there: resuscitation, restitution, restoration and rehabilitation or review of the patient. So resuscitation is a attempt to bring the patient normal with the parameters. Not that je ami bhalo achi. Your parameter will say that I am fine, I am okay. So restitution means it's a very transient phase. What does it mean? That all the parameters, some of the parameters again rolled back. Say WBC count is not coming down, so 11,000, 16,000, that stage is restitution phase. So patient is not all the way normal to receive the mandatory management or final management which we want to serve him, right? That is restitution. And when the restitution phase has overcome, it is a transient phase but unseen phase. But what is seen phase? That is restored phase. By this time the patient, your pulse is normal, blood pressure is normal, respiration is normal, WBC count is within normal limit, urine output is within normal limit, and C-reactive protein is gradually declining in the initial stage. So these are the parameters by which you can tell that this patient is restored patient. Any intervention of this patient is done in this restored phase, because unstable patient and any operative procedure means the patient is, you are going to lose the patient. সিনেমাতে যেমন দেখো পেশেন্ট ধরে নিয়ে গিয়ে ওটিতে ঢুকিয়ে দিল, ওখানে ডাক্তার হাতে গ্লাভস পরলো, পরে অপারেশন হয়ে গেল, patient is, operation is successful but the patient is dead. এগুলো হচ্ছে সিনেমার ডায়লগ। আমরা যেটা করি জাস্ট দ্য রিভার্স। wait and watch. Parameters will come to the normal stage. Then you operate on the patient. Right? So, this stage is a very short stage by which the snap deal comes. It is a mnemonics, not that. S stands for sepsis control. N stands for nutrition backup. A stands for area mapping. You map the area, what you are going to do. And P stands for final thing, which is plan for your final stage of operative procedure. So, all the 4 are, and the SNAP is the basic line of management you are to do in a septic condition, in a sepsis of the patient. So by this time, what is the management procedure? One is intravenous fluid. So you may not get again. The sepsis has 3 bloody sequences, and these are the very lethal triad for the sequential management for a septic condition. One is metabolic acidosis, the pH is high. Then hypothermia, cold clammy extremities, and finally, if not treated well, then he or she may develop coagulopathy, disseminated coagulation. Everywhere that multiple coagulative procedures that comes, these 3 bloody vicious cycles to be avoided from the very root of the management. So, one is intravenous fluid, one is intravenous broad spectrum antibiotic, one is acid secreting counter, that is a pantoprazole, that is proton pump inhibitors, and third is a painful condition, and that control of pain, and fourth is the patient's regular monitoring system. And show that these are the things, and by these parameters you can tell that this patient is going to develop sepsis and I am there to manage it. So management procedure is in the hand of your team, and all the team will be there, be a septic, the nursing station, be a doctor there, and a paramedics, and the group D staff, and the statistician also. By combination, this team, they can manage the patient in sepsis control, and all the 4 R and a SNAP deal is the basic line by which you can control the patient in a state where the patient developed sepsis. আমি তো শেষ করলাম. Now questions. These are the full length questions from UG to PG at any level. আমি তোমাদের কাছে একটা কথা বলবো, যে তোমরা 1 page answer, একটা ছোট্ট কোশ্চেন এটা লিখে ফেলো. আউটলাইন দ্য ম্যানেজমেন্ট। আর থার্ড পার্ট যেটা সবাইকেই বলছি, দেখো পরীক্ষার সময় ওই জেরক্স, কালো ঘড়ি, ফোন থেকে কপি, থিসিস কপি, হয়তো এটা থাকবে তোমার 10 নম্বর। কিরকম ভাবে থাকবে? নাম্বার হয়তো, আমি এটা কাজে এই যে নাম্বার দেখে আনসার করবে, অ্যান্ড ইউ রাইট ইন দ্য ফ্লো চার্ট। ফ্লো চার্ট বোঝো তো? সবাই জাস্ট আউটলাইন দ্য থিংস। অলমোস্ট আমি তোমাদের যেটা লিখে দিয়েছি সেটাতে দেখবে সেপসিস, বইতে প্রচুর আছে, অনেক কিছু, আরো অনেক কিছু আছে। একটা জায়গা আমি বলিনি, যেটা তোমাদের এখন বলেছি, দিস ডিউরিং সেপসিস দ্য ম্যানেজমেন্ট ইজ এ ড্যামেজ কন্ট্রোল প্রসিডিওর। তোমরা এইটুকু আমি দিচ্ছি, দেন ইউ জাস্ট শার্প এনিওয়ে। যে কোনো বইতে তোমার এটা কি এমআরসিএস বইটা কিসের? হ্যাঁ, আচ্ছা, অন্য বই। এনিওয়ে তোমরা দেখে নিও হোয়াট ইজ ড্যামেজ কন্ট্রোল প্রসিডিওর। শর্ট নোটও থাকবে, লং কোশ্চেনও থাকবে।
So I'll explain about the topic today. So what are the types of infection here you can see? The infections are the superficial infection, the deep infection, and some organ-based infection. And what are the risks, or what are the risks that can lead to the infection? That is the increased morbidity, increased mortality, and also the increase in hospital and the cost of management. Now, there are centers. There are centers where the infection can happen. The centers are some centers like the stitch abscess, also in the episiotomy wound or in the circumcision areas there can be the infection. Also, it can be due to the infected burn, and also it can extend to the fascia levels and also into the muscles. Now, there are some types of wounds like the clean wound, which looks clean, but there's subjected a mild infection or small infection. Then the clean contaminated wound, this clean contaminated wound which seems a bit clean from the outside, but actually from inside there is some kind of infection. Then comes the contaminated wound that is totally contaminated in a road traffic accident. If the person falls from the bike or from the vehicle and then the dust particles come around the wound, then it comes under the contaminated infection. And then comes the dirty wound, where there can be an accident in a field where the wound is full of mud, like that. It's kind of emergency. Then comes the nosocomial infection, that is the infection that is acquired from the hospital. Then what are the bacteria, what are the agents that can cause this kind of infection? They are the Staphylococcus, Streptococcus, and Pseudomonas, which are the most common organisms which cause this kind of wounds. Then what are the risk factors for these wounds? The risk factors can be the comorbid state, that is one of the comorbidity we all know, that is the diabetes mellitus, very risky for any kind of wound. Hepatic, pancreatic, or any kind of renal diseases, or in the laparoscopy surgery where there is a portal invasion, there can be some kind of infection near the ports. Then comes the topic that is the parameter of the sepsis, where there will be the history of morbid and comorbid states, then the dolor, pallor, and rubor, tumor, and punctologia. They are the parameters which they can identify about the infection. Then comes the pulse rate. We know the normal pulse rate is from 60 to 100 beats per minute. The pulse rate will increase. The respiration rate, the normal respiration rate in adult human is 14 to 20, but in case of an infection, it will increase more than 20, which will confirm us that yes, there can be a different infection. Also, the WBC count, where it can drop below 4,000 per cubic millimeter, and if it drops down, then we can identify that yes, there can be a chance of infection. Also, the temperature, it can be hypothermia, that is less than 34 degrees centigrade, normal body temperature, or there can be hyperthermia, that is more than 38 degrees centigrade. And then on the urine output, the urine output will be 30 to 20 ml per hour. Also, there's a very important thing, that is the C-reactive protein. The normal level of C-reactive protein is 0.9 mg per dl. case of any infection, it will really increase, and it will increase much more. It will increase to 30, it will increase to 40. So there you can understand that yes, there is a proper infection in the body.